All right, want to welcome everyone for joining us today for our panel conversation with celebrating Hispanics and African immigrants by addressing health disparities. Thank you for taking the time to be with us today. It's my honor and privilege to be with a couple of my colleagues. First, let me just quickly introduce myself. My name is Kristi Leonard. I'm the Assistant Dean of Students at Central College in Pella, Iowa, and I am the National Wellness Institute Board Vice President. And I get to be joined today by Eirasmin Lokpez-Cobo. She's the Vice President, Cross-Cultural Brand Strategy, Latitude Health, Founder and Director, Wellness for Growth Foundation, and she's also a National Wellness Institute Board member and a member of the Multicultural Competency Committee. And Anita Mwalui is also with us today. She's the founder and CEO of Community Engagement and Consultation Group. She's a multicultural subject matter expert and the National Wellness Institute's chair for the Multicultural Competency Committee and an NWI board member as well. So thank you, ladies, for joining us. I'm eager to start the conversation and have some conversation with you. And so why don't you start off by telling us the significance of celebrating Hispanic and African Immigrant Heritage Months?
Absolutely. Well, thank you, Kristi, for that intro. And I'm very excited to be here with you ladies talking about these very important topics. And I think I can kick it off with Hispanic Heritage Month. Hispanic Heritage Month is definitely a celebration of Hispanic culture, tradition, and definitely their impact in the U.S. society at large. It started being celebrated in the 60s as a week, and then it was expanded to a whole month, and it goes from September 15 to October 15, and it coincides with the celebration of the independence of different Latin American countries, as well as with Columbus Day or Dia de la Raza. What is very important to know about Hispanic Heritage Month is that for those of us who are Hispanics, it doesn't really have a consistent meaning across different groups, because pretty much is a U.S. celebration of the Hispanic culture. So what we are proposing today, and that's part of the conversation that we want to have, is to really give meaning to this celebration during a year like the year that we're living right now in 2021, and come together to raise awareness on the one hand and also work towards a more equitable future for all when it comes to healthcare disparities. And we're going to be expanding a little bit more why this is the perfect time to really raise awareness on the topic and work towards addressing health gaps.
Well, okay. Yeah, thank you, Eda. Thank you, Kristi. Well, with the African immigrants, Montgomery County in the state of Maryland was the first county in the nation to proclaim September as the African Heritage Month. During this time, we celebrate the history, culture, heritage, and ancestry of Africans in the diaspora with pride. And as a result, we've seen other diasporas in different states do the same. So we try to link what we do here in different states, to make sense of our rich culture. And the way we look at the statistics, we see that 41.7% of households speak a non-English language at home as primary. So that is strong. Here in Montgomery County alone, we have over 160 languages spoken. So you can just imagine the strength, the heritage, the richness of the diaspora. And during this month of September, we acknowledge a whole lot of things, what this country has given us and what we can share and bring awareness to what's happening to people, what impacts people's livelihoods. The diaspora is urged to participate in events that aim to shape their communities and be on the forefront in addressing their issues as part of their civic engagement. And as a matter of fact, during this month, there's been a lot of events, including what I have been doing from the beginning of September all the way to the end of September. This is, raising more awareness, whether it's employment, whether it's healthcare, whether it's governance. What does that mean to us? And how can we be active members of this society that has given so much to us and what we can give back to them?
Yeah. Lydia, your approaches to celebrating these two events and months is by increasing awareness is very interesting. And, the health disparities piece too, because we're in such a time of social justice and awareness. And then we're also in a time of such health, especially with COVID happening. And I think this is more relevant than ever now. And so I'm really glad that you guys are helping to bring it to the forefront, bring it to people's attention, and bring that awareness about. I know in my case, working with college students, they are ready to go. They are active. They are wanting to have a voice. It's for so long, they felt like they've been silent and had to be silent. It's so invigorating to watch them say, hey, we're tired of the oppression. We're tired of the injustice. How can we help? How can we make our communities, both on campus and just the larger community, a better place as a whole? So bringing this awareness has been great for them and for them to be a part of that too. So I think these months are very, very important. I guess it's kind of unfortunate that it's just a month, that we really are intentional. We need to do more. And let me just ask you a question about that real quick. So we're looking at a month, we're looking to be intentional. What are thoughts on both sides of this? Why don't we celebrate, or why aren't we intentional for more than a month? Or the flip side, why do we need a month? For those who are on the opposite side, what would your response to that be?
Yeah, I think that's an excellent point, Kristi, because at this point, a month is definitely not enough when we're talking about the topic of healthcare disparities. The reason why we wanted to have this conversation is because we wanted to use this month just as the first stone in our journey towards raising awareness of the gaps that we currently have in a country that is increasingly multicultural. And from that kind of like raising awareness stage, starting to collaborate from different standpoints, based on different disciplines, so we can all come together to address healthcare disparities. And particularly, again, in a year like the year we're living right now, where we know that based on the 2020 census, the US multicultural landscape is more evident than ever. And then at the same time, when after COVID, we now have heightened awareness of the disparities that surround us. So it's just the starting point.
Well, thank you, Ada. To echo on that, and in my line of work, advocacy never ends. It's ongoing. But this particular time, and considering what's going on right now with COVID, and having seen, those that have been impacted the most, we've also seen that immigrants, non-Native Americans, have been impacted a lot. We don't see those numbers anywhere because a lot of us are quiet in our own homes. So this is an opportunity to raise more awareness. People need to be vaccinated. What's in place, what are counties and states offering to those people, where those hard to reach populations, what kind of messaging, what kind of communication. So the month of September today, this time, is used as a month that actually is more significant than ever. Now, in the previous years, we've been doing the same thing, except that there wasn't COVID. But this particular time, it's more than important to raise more awareness of what those inequalities are, what are the disparities are, what are those social determinants. We've seen that there's been a lot of underlying conditions that have affected those who have actually succumbed to COVID-19. So we are honored to have this opportunity to raise more awareness, to continue the advocacy.
Excellent, great, thank you. Now, you mentioned the multicultural landscape, how that is changing. Can you delve more into that? What are some of the numbers? What's some of the percentages? What does that look like?
Absolutely. I mean, right now, it's amazing because we already got the 2020 census result. And it's almost like, people are starting to realize that multicultural groups not only are having an impact on the mainstream, but they're really driving the growth. So when you look at the numbers from 2010 to 2020, it was the first decade in the nation's history when the non-Hispanic white population declined. You look at the percentage of multicultural groups right now as part of the total population, multicultural groups now account for 41% of the total US population. And they have been driving the growth, but not only that, they are projected to drive over 100% of the population growth. When you look at the younger groups are also increasingly multicultural, Generation Zers, millennials. And those younger groups right now, they account almost for over 50% of the population. So what this means is that definitely the US is increasingly multicultural. We're seeing different values, cultures, traditions merging and intertwining, having an impact on each other. And what that means for us is that this is definitely the time to really think on the impact of not doing the work, not coming together, and not addressing health disparities and the social determinants of health that impact minority groups right now.
As a matter of fact, when you look at, again, at the landscape and the multicultural aspect of it, we have also seen that, even within the social determinants of health, right, the determinants that are being mentioned, it's more than that. Within the immigrant communities, we see that there's language literacy, which has affected a lot of people in understanding what are those disease preventions that I need to consider in order for me to stay well. So multiculturalism here is very important, especially, in service delivery. As a service provider, if I'm putting out, or when I put out my services, I'm also considering in the back of my mind that, there are these different languages. How can I communicate effectively in different languages that people can understand? That's the only way we will be able to reach out to a vast majority. And I'm glad that the census has finally come out to actually have a clear picture.
It's interesting you bring up the census numerous times, because I think that actually brings validity to the argument for needing to have more awareness, more education. Before people could just say, well, that's not necessary. Well, we have data to prove it. And I think that is so important to have data and numbers to back us up for the necessity for what we're doing. So I think that's great that you both pointed out the census and that information.
And Kristi, just a second, to point out, when you mentioned data, a couple of days ago, I was in a webinar, and one of the things that came out was data literacy. The data we have here today is what came out of the census. But when it actually comes out, it comes to outcomes and what's needed, what's desired. That's the data that we are missing. So this is more than important to how do we correlate what we've seen or what we're seeing with the results of the censuses that have come up and what we are about to do or within our service delivery. That's going to be significant, and hopefully that will provide the needed data we need in public health.
Certainly. So we talked a little bit about COVID-19, that was touched upon already, but can you add your perspective on health inequities and then talk about the impact COVID-19 is the second factor that we want to consider in 2021 when it comes to raising awareness and coming together to address health disparities. So a little bit more about COVID-19 and the impact that will play.
Exactly. Yeah, that's kind of like the second point that is bringing everything together, right? So 2020 kind of like it brought us two clashing realities. One, we already talked about it, and is the US Census numbers, the multicultural landscape. And then on the other hand, it brought us COVID-19, and with COVID-19, the heightened awareness of those groups that are really driving the population growth are groups that are being underserved, that have been underserved for a very long time when it comes to healthcare access. So one of the things that we all know about now is that minority groups have been disproportionately impacted by COVID-19. And not only that, when it comes to COVID-19 vaccine uptake, they also have lower uptake than non-Hispanic white groups. And this is due to several barriers. We're talking about historical racism and mistrust, but at the same time, we're talking about, as Anita was mentioning, and also you, Kristi, the social determinants of health. When we look at racial and ethnic minority groups, they are 1.5 to 2 times more likely than non-Hispanic whites to have chronic diseases, to have major chronic diseases. And the sad part is that most of these chronic diseases are preventable, but there's a lot of work that we need to do. And, as we all know, these are groups that they reside in highly populated areas and sometimes in unsafe or unhealthy environments. They many times rely on public transportation where they can be more exposed, for example, to COVID-19. And they have higher dependency on frontline jobs and more economic instability, higher barriers to healthcare access, like, for example, lower insurance rates. And then also, of course, when you put all these different factors together, it's just very easy to see how they can have higher vulnerability to COVID-19 and how all these pre-existent disparities just became more evident. And with that, it also became more evident that we need to start addressing them right away.
Yeah, there's obviously a lot of things not in underrepresented folks' favor that are already stacking the cards against them. So, it's those historical things and what the traits are that they need to overcome the barriers. But then you add COVID to that, and there's just so much additional and stuff for them to access and to get, whether it's the education, the correct information, et cetera, et cetera. It's just climbing up a hill, difficult to climb, but we need to. It's time we have to.
Exactly.
Thanks.
Exactly, yeah. And we use this month to raise more awareness, as well as the historical legacy, behind what these disparities are, how even asking ourselves, is everybody treated, or is everyone treated equally? A lot of immigrants, have no idea, what the overall background of how these inequalities started. So it's our job as providers and advocates to talk about these issues, bring them to the forefront, have them participate in civic engagement, have them voice out, be the voices of their own community, and also making sure they understand what health inequities are. They're broad. They affect a lot of communities in various dimensions. And like I said, inequalities and social determinants of health, they go beyond to include community inclusion, community violence, racism, as my colleague Ada mentioned, other forms of discrimination like employment, natural disasters, housing insecurities. We've seen what's been happening for the last 18 months, whereby people are on the verge of losing their homes. That's also part of, social determinants of health. It's important that, we understand and we also have people participate and continue advocating. We need also to explain to our groups and individual groups, since we all identify differently. Our needs are totally different. So having to understand what those needs are, community assessment is very important. And that's why, here in the great state of Maryland, we have a lot of initiatives going on whereby, health departments, nonprofit organizations, we all engage in assessments to see what are various regions, where they are in terms of health. What do they need? What funding is available? How can we help our community live, thrive, and be healthy? Because we've seen what has happened with COVID-19.
You know, the word that keeps coming to my mind, I don't know if we've even explicitly stated it yet, but it keeps resonating with me, is the word intentional. These things do not happen on their own. These things, these initiatives, this action, this education, this awareness, we need to be intentional about that and target all kinds of folks for that. But then what we do has to be intentional, and we have to think about those outcomes. We have to think about where we're putting our money. We have to think about that accessibility. We have to think about that data. All of this, there needs to be intention behind it. And so that word just keeps going through my head, is the word intentionality. So I think everything that you've discussed thus far has a tone of intentionality to it. So putting everything together, the cultural shifts along with the imminent health disparities, what sincere conversations can we have around working together to address these disparities in our service delivery?
I think, the conversations that we need to have, sincere conversations, is that how do we deliver effectively the messages? Communication messaging is key. And that's why, during this time, we've seen a lot of vaccine hesitance because the communication was lacking. But today, if you go to the CDC website, you'll actually see that a lot of creativity has evolved, how we as providers should communicate, because we have to abide by the standards that have been set to combat this pandemic. So I would emphasize that the way we communicate is key to how we're going to reach out to our community. Otherwise, it's going to be, it'll be one of those things that we have to go back to the drawing table.
I completely agree, Anita. I mean, I think that communication is key. I think that, of course, we need the different players stepping up and playing a role pretty much on and assuming responsibility on this journey towards addressing health inequities. I think that from kind of like a communications or marketing standpoint, that it's a little bit of my background and where I come from, I definitely want to encourage corporations to step up. And many of them have been doing so. When we look at the data in 2020, corporations pledged over $66 billion to racial equity initiatives. And a lot can be done, not only with these funds, but also with, as you were saying, Kristi, with the right intentions, followed by the right visions and the right strategic plans that will translate into actionable steps that can be taken by different players in our society. When we're talking, for example, about the role of healthcare and pharma markers, that it's kind of like, where I come from, I really want to highlight the importance of putting together integrated strategies and putting together culturally relevant messaging that can really resonate with different groups. Only if we put together comprehensive initiatives, we're going to move the needle. And we're talking about moving the needle from many different standpoints. We need to start from ensuring fair representation in clinical trials. And that means overcoming a lot of fears and barriers and mistrust that have kind of like characterized clinical trials in the past. And then developing disease awareness and disease education initiatives, because when we look at these groups, as you were saying, Anita, and also you mentioned it, Kristi, it's all about education and health literacy. And if you have lower health literacy, that definitely is going to impact your access to healthcare, but then also at the same time, your own approach to health. And then also developing culturally relevant patient communications. And that needs to be, as you were saying, Anita, in language and then also in culture. And, they're not the same thing. Translating something is not going to make it magically relevant. The term that we use is either transcreate or develop original communications that really resonate with the values and the culture of these different groups. Everything needs to be rooted in insights that make your campaigns or your programs or your communications relevant. Then, of course, if we're thinking, for example, on media buys, if you're going to be doing media plans, well, it's all about doing media plans to reach people where they are. And we know that this audience are digitally savvy, that they over-index in mobile, for example. So can we put together, for example, a health education campaign that reaches these audiences or these patients or, in their mobile phones, and then at the same time, collecting data to help the patients through the patient journey. So all of these are different pieces that can be part of the puzzle. Then also increasing the cultural proficiency of healthcare providers. That's another point that is relevant. The patient doctor relationship is key. And if the doctor it's not culturally proficient, then he or she might miss a lot of different nuances in that communication and that relationship with the patients. And then finally, a little bit of what you both have been saying in the past is the partnering of the different entities, like going farther than just, when I'm thinking marketing and communications, but it's partnerships of governments, nonprofit organizations, corporations, communities, celebrities, influencers, everyone who can raise their voice and play a role on this very important journey.
Yep. You said it all. I'll tell you this, you said something about, patient-provider communication. That's key. One of the things that, we see is we're in a system whereby it's a one-size-fits-all. So as from the multicultural perspective, we try to move away from that. Let's make it, a patient-centered. Let's look at the patient and meet individual needs. It's a little bit expensive and it's time-consuming, but, to me, a good provider is one who actually looks at a patient as an individual versus putting everyone in a one pool to make it seem a one-size-fits-all. And then on the other point of communication, with the health literacy, limited English proficiency or limited language proficiency, that's key. One of the campaigns that I've seen, they used animation in the spread of COVID, which most people were able to grasp versus having caption. There's a lot of miscommunication going on. And so for immigrant communities, listening to this communication, it can be dangerous to one's health. However, when you see something that has been put into animation, with the spread of COVID, it's much easier to understand and then to take the necessary measures to protect yourself. So some of these things, is what we try to do. They're grassroots versus, sending our clients or our community members to a website, go and read that, because it's much easier to tell someone, go to the CDC website, they have everything. That's not the way we should reach out to our communities.
You mentioned a one size fits all, and I like to think of the flip side of one size fits one versus one size fits all.
Yeah.
And I agree with everything you've said. These great ideas, these excellent suggestions, strategies, they're very, for some, aspirational and can be very overwhelming. So for the folks who are listening today and with us, what is something that I, as a lone individual, can do? I want to collaborate with others. I want to connect. I want to go for those big goals, the big picture. But what can I do as one person to help reach those goals?
Yeah, I think, go ahead, Anita. Go ahead.
I would say, to reach those goals, to understand that, health and wellness should be looked at from various dimensions, not just one dimension. In various dimensions, meaning that, people identify differently. There's a lot of variables that people bring on as they come into communities. So it's very important to look at health from various dimensions. Even the social determinants of health, I think, should be beyond that. We don't mention circumstantial and situational factors that also influence how we live and be active in our communities. So it's very important to understand as we go back to our various groups, friends, or wherever we decide to go.
Mm-hmm.
Yeah, I agree. I think that to me it's all about empathy. I think you start there. You start by recognizing, the reality that surrounds you, the community that surrounds you, understanding that, that we're all interconnected. And from there, something that I have seen that works very well, and we have mentioned it here in the National Wellness Institute before, is the Liberative Dialogue. And it's having the ability to, let's say, for example, in your community, in your building, to sit down and really listen to someone else's perspective, their tribulations, their needs, what they're going through. And then from there, being able also to share your own. And based on that, sometimes being able to agree on common solutions that are beneficial. Let's say if you're doing this in your church, in your community, even in your building, in your family, that are beneficial to everyone who is involved in this group. So to me, it all starts there with you being able to put yourself in someone else's shoes, listen, and then being able to act together.
It does resonate with me with our college students. We talk about leaning into the discomfort and having civil dialogue and conversation and listening to understand. So those are some of the common themes that we're trying to tout with our students. So it's good to hear the parallels with that.
Yeah, Kristi, very interesting. Just a minute. In mental health, we have this phrase. One of the phrases we use: listen non-judgmentally. So when Ada, you mentioned listen, that's key. Listening non-judgmentally, because a lot of people that come to us, they have a lot of challenges. So the key is to, like you said, being listen with empathy, listen non-judgmentally, and understand where those people are coming from and how to guide them throughout their challenges.
Great, thanks. Ada, Anita, thank you so much for sharing all the thoughts that you've had, your final thoughts, some really good stuff for us to take home, to work with, to collaborate with. We heard the word mentioned interconnectedness. We heard the word mentioned intentionality, things that we can do and need to do. And so I want to thank all of you for joining us today. Look forward to further conversation with Anita and Ada, and for you on the audience, in the audience as well. Have a great day.